Oh, I just noticed my head is floating on the screen. Okay. Good morning, everyone. Welcome to our CUGH Global Health Operations Committee satellite session. My name is Summer Hassan. I will be one of the facilitators today. So I'm gonna go ahead and get us started. So today's topic is actually on resilience and preparedness, strengthening global health operations during the times of crisis. Okay. So just a few housekeeping rules. So today's session is actually in meeting format, meaning that you will have the ability to unmute and have your video on. But please, for the just for some computer logistics, if you could just make sure that your mic is muted at all times, just to avoid any echoes or background noise. If your connection is slow, then you're more than encouraged to stop your video throughout the session. And then if you have any questions that you would like to make a comment, we encourage you to use the chat function first, and then that way we can allow our panelists and our moderators to accommodate for those questions in a timely manner. So this meeting is currently recorded. However, breakout sessions are not totally guaranteed, but we are trying our best to make sure that those sessions are also recorded. So if you're on your phone, just make sure that you have your microphone muted on your phone as well, and camera, etc. And then if you have any questions just about any Zoom logistics throughout, you're more than welcome to reach out to me throughout the time. And also we have a CUGH admin, Sarah, on the call that will help with tech support, and then Carrie as well as Anna. So please feel free to shoot us a IM in the chat, and then we'll most definitely get to that. So yes, tech support. You guys can email us, but personally, I prefer if you just message us in the chat for today, and then that way we can accommodate for any technical difficulties. We'll be able to help with that. Great. So I'm going to pass it off, to Anna to give us a little overview on the committee.
Hopefully it works. Okay. Hello, everybody. So welcome to the session of this Global Health Week. I'm Anna Helova from the University of Alabama at Birmingham, and I'm also a co-chair of the Global Health Operations Committee of CUGH, along with Dr. Richard Wamai. So let me just very briefly introduce our committee. So Global Health Operations Committee is one of the 8 CUGH standing committees. Our committee is dedicated to identifying and developing guiding principles to enhance university and organizational administration's procedural and financial alignment with programmatic priorities in global health, education, research, and service activities. We develop strategies to effectively respond to global opportunities and share best practices for various situations and operations. For example, legal frameworks, administration, and establishing and sustaining global health partnerships. Next slide. Okay. Our subcommittees that we have focus on administration and oversight best practices, institutional exchange of resources and information and communication. Then we have a subcommittee that is dedicated to Global Health Travel Toolkit. And we also have a subcommittee that focuses on incorporated voices and perspectives of the Global South. Thank you so much. And again, welcome to today's session.
Thank you so much, Anna. So please let us know where you're joining us from in the chat. If you could just put your name and just where you're joining us from, we'd love to see. Thank you. So our session objectives today are to discuss global health in just 3 different lenses. So we want to discuss preparedness and how to build capacity in global health through infrastructure development, workforce training, and enhanced supply chain management. Discuss rapid coordination during crisis response, and explain resilience and how to develop long-term strategies for sustainable global health systems. So today we have four distinguished speakers that will be joining us to provide their perspective with viewpoints on the Middle East, on South American countries, as well as Africa, with a specific focus on Ghana. So I'm really excited for you guys to hear from our panelists today, who will be introduced shortly. And then here's just a session outline of how this day will go. So currently we're in the introductions, and then we are going to head into our first breakout session shortly on preparedness, and then on response and on resilience. So one thing to keep in mind is it's ideal that if you're joining the discussion on the Middle East, we encourage you to go to that session throughout each breakout session, because the conversation from preparedness will really lead into the response aspect and will also lead into the resilience aspect. So it's a great opportunity to really understand the global health perspective in depth from our panelists' personal experience and view. And then we will have a session overview and closing remarks. So each breakout session will last approximately 30 minutes. And then we'll come back into the general session after each breakout session to have a debrief. This will allow our moderators and our panelists to have approximately 3 minutes to share some very high-level points that came out of their breakout sessions that they would just like to highlight. And then we'll go into our next breakout session following that. So I'm going to now pass it off to Carrie. So oops. There you go.
Thanks, Summer. You can go ahead and go to the next slide. So I'm going to go ahead and start introducing each of our guest speakers and our panelists, and they are in order for which breakout room that they will be in, and we'll see an overview slide of that at the end of each introduction. So our first breakout room is going to have 2 speakers. The first speaker is going to be Dr. Pascal Felix, and Dr. Felix has more than 25 years of experience in implementing laws, regulations, and guidance pertaining to the manufacture of drugs, biologics, and medical devices. He is a subject matter expert in the development, implementation, and management of quality management systems and programs, and has worked on domestic and international projects, especially in Haiti, Ghana, and Costa Rica. And his research interests include biomedical engineering, traditional medicine, and the central nervous system. So welcome, Dr. Felix. And in the shared session is also Dr. Gabriel D. Erauskin from the Zachary Foundation Distinguished Professor of Neurology at Glenn Biggs Institute for Alzheimer's and Neurodegenerative Diseases, and the Greehey Family Foundation Distinguished University Professor of Alzheimer's Research at the University of Texas Health San Antonio. He is a physician scientist with board certifications in neurology and psychology, or psychiatry, and holds an MD and PhD from the Universidad de Buenos Aires and an MS in genetic epidemiology from Washington University. His research focuses on neurodevelopment, neurodegeneration, and the susceptibility of dopaminergic neurons to environmental challenges, with applications in Alzheimer's disease and cognitive decline. Currently, Dr. D. Erauskin leads the ISA-VRAD study, a major project funded by the NIH, the NIA, and the Alzheimer's Association, investigating the gene-environment interactions between SARS-CoV-2 infection and genetic variation in diverse populations. And his research explores the neurologic effects of COVID-19, particularly on Alzheimer's disease and related dementia. So welcome. And thank you for both serving as panelists. So next slide, please. We'll introduce breakout room 2. So in breakout room 2, we will be focusing on the Middle East. And I'd like to introduce Dr. David Vanderpool. Dr. David Vanderpool is a general surgeon and the founder of Live Beyond, a nonprofit organization dedicated to improving maternal and child health care, education, and nutrition in low-income countries. Since 2005, Live Beyond has provided these vital services to vulnerable communities in Africa, Central America, Haiti, and the Middle East. Dr. Vanderpool's work includes building hospitals, clinics, and sustainable health programs directly impacting over 10,000 mothers and children. Motivated to address global health disparities, Dr. Vanderpool and his wife, Lori, have lived in Haiti and the Middle East since 2013. Their on-the-ground presence has been vital in understanding and meeting the unique needs of these communities. By leveraging technology to streamline healthcare delivery, Live Beyond ensures its programs are sustainable, effective, and far-reaching. Long-term solutions to some of the world's most vulnerable populations. Also, Dr. Vanderpool is has published several books and multiple peer-reviewed articles on various global health topics. So again, that is going to be in breakout room 2. So welcome, Dr. Vanderpool. And then next slide, please. Thank you. And our third breakout room is going to be with Bernard Owusu Ijare. And Bernard is a public health professional and a former military captain in the Ghana Armed Forces with over 15 years of expertise in civilian military coordination in outbreak response, humanitarian emergency response, and security coordination and infection prevention and control in complex humanitarian emergencies. Bernard is currently a doctoral candidate in the Global Infectious Disease Program at Georgetown University and also a senior research associate at Georgetown's Center for Global Health Science and Security. His research was focusing on military deployments and outbreak response. He previously deployed as a peacekeeper with the United Nations in the Republic of Liberia and the Democratic Republic of Congo. In Liberia, Bernard initiated and supervised an IPC program within the Monrovia UN camp that ensured that forced deployments did not record any Ebola or Lassa fever cases. As a platoon commander in the DRC, he commanded CIMIC patrols, and he conducted community-based needs assessments, which led to MONUSCO-sponsored quick impact projects, such as construction of drinking fountains in some communities. He also leveraged his public health expertise to support the UN and the DRC government to respond to the deadly Ebola outbreak. In this role, Bernard coordinated with several UN agencies and led humanitarian convoy operations to facilitate the movement of logistics and other essential medical countermeasures to Kikwit and other hard-to-reach areas. Bernard holds an MPH in Global Health Infectious Diseases and a certificate in Complex Humanitarian Emergencies from Emory University and is a member of the World Health Organization Technical Working Group on Civilian Military Coordination in Health Emergencies. So welcome, Bernard, and thank you for participating as a panelist. Next slide, please, Summer. Okay, so in each of these sessions, there will be a session moderator. In the main room will be Summer Hassan. I will be the moderator in session 1, and Dr. Anna Halova will be in session 2 or breakout room 2. And then we will have 2 moderators in the breakout room 3. And so I just wanted to give a brief introduction. So Summer Hassan is the grants manager at the Arizona Advisory Council on Indian Healthcare. I am Dr. Carrie Brossard-Stuess at Ithaca College in the Department of Health Sciences and Public Health. Dr. Halova is at the Sparkman Center for Global Health at the University of Alabama, as we already have been introduced. And then Dr. Oriaku Okereke is at the University of Abuja, Nigeria. And then we have Tasha Ayinde from the Director of Administration and Operations School of Population and Global Health and Administrative Excellence at McGill University. Thank you. And next slide, please. And so here's an overview again of each of the breakout rooms and which speaker is in which room. Again, room 1 is going to be Haiti and South American region. Room 2 is going to be the Middle East. And then room 3 is specifically going to be Ghana, with some examples from other examples in Africa. So thank you for attending, and we invite you to join a breakout room.
Thank you so much, Carrie, for those introductions. Yeah, so as Carrie just mentioned, we are actually going to head into our first breakout session of the day. So we will open up the breakout rooms, and if anyone has any issues assigning themselves to those breakout rooms, just let me know and I can help get you in the correct room that you want to get into. But breakout rooms should now be open, and we're starting off with preparedness. So again, just a reminder, we have those 3 topics that will be South America, Middle East, and Africa, specifically Ghana. So yeah, please go ahead and join those breakout rooms. Hello, everyone. Welcome back to the main session. We are going to actually debrief on each breakout room. So I'm actually going to go back a slide. If we could start with room 1. So I know Carrie was moderating that. If Carrie or Pascal or Gabrielle would like to give a little insight on their discussion, please feel free.
Thank you, Summer. I would actually, Pascal, would you be interested in just giving a brief debrief? Thank you.
Absolutely. It's always a learning opportunity when it comes to my interaction with Gabrielle. And one thing that I will take away from this breakout room is the role of simulation when it comes to informing risk. This is, I hate to admit, something I have not dealt with, but I will now. Thank you, Professor. Because at times we just don't have the luxury of experience. Experience is costly, especially in resource deprived environment. Nevertheless, this is an aspect that we'll take. Also, I am cheating because we have interacted also quite a bit throughout the years. The need of clinical data, biomarkers, to inform population health, to be better equipped with data, not only empirically, but also what I mean in the abstract when it comes to simulation, when it comes to risk identification and management. So this is definitely a takeaway I got from that breakout room. Thank you.
Wonderful. Thank you so much for sharing. I'm going to pass it off to David.
Yes, in our section, we talked about assessment of risks going into low and middle income countries, specifically centered around the Middle East and other countries that we've worked in. The assessment of risk, I think, can be had through online sources. So looking at State Department travel warnings, performing SWOT analyses. There's several other good tools for looking at that. Also, though, developing relationships with the central government is very important so that if you're dealing with them on a medical basis, you'll have those relationships built. We found that that has been extremely beneficial for us and our safety. But then, very importantly, developing deep relationship with the local indigenous people that you'll be serving. This group of people will understand deeply the security risks of the area, and if they like you, they'll probably share those with you. And so it's very important to develop those deep ties to those whom you serve.
Wonderful. Thank you so much for that insight. And then Bernard.
So for our breakout session, we had a wonderful discussion on preparedness with a focus on Ghana. And one key thing that came out of this discussion was something that with healthcare security. So since workforce is one of the primary or key pillars of health system strengthening, and we need strong health workforce, what happens if the life and safety of healthcare staffs are threatened, even as we prepare for potential outbreaks here and there? And so having a common blueprint or a framework to protect, and especially in a region marked by violence, civil unrest, political instability, and conflict, there's a need to bring this discussion on how to protect healthcare staff. The other issue was finding local solutions to local problems, instead of maybe waiting on external partners to provide response strategies or provide logistical support to us. What are we doing in anticipation of outbreaks? Because whether it's disease X, the unknown pandemic that is anticipated, or any outbreak that can come in the future, we need to be in a position to build these medical countermeasures, develop and manufacture these medical countermeasures locally. And the other one is testing, the ability to quickly detect these outbreaks. So whether we have to find innovative strategies to design metagenomics that can have this widespread detection capacity, that is something we need to look out for. Of course, we came up with a case-based scenario, how it's played out, and we couldn't discuss it because of short of time, but we could clearly talk about the establishment of emergency operation centers just to facilitate cross-sector collaboration in anticipation or in response, surveillance at point of entries and border crossings, intense public health education, community engagement, sensitization, and also the issue of collaboration with stakeholders like Africa CDC, WHO, and other international health partners like CDC. So these are things that came up in our preparedness discussion.
Wonderful. Thank you so much, Bernard, for sharing. And then Gabrielle, do you have something to add to about your session?
Forgive me, I was looking for the mute. Yeah, one very brief mention. I think that in preparedness, since it hasn't come up, I wanted to raise it. The other key element is obviously capacity building. In our session, I spent a few minutes talking about what capacity building effort have achieved in specific low resource settings in the central Andes of South America, and how that influences your ability to respond in the situation of crisis, in particular in the situation of the COVID-19 pandemic. So I think that capacity building efforts are central both to the acquisition of knowledge that you need to establish risk assessments and risk simulations, as well as to your ability to respond when the crisis actually presents itself.
Thank you so much for highlighting that. You guys all have spoken clearly about very significant discussions, and I'm excited to see what comes out of the next breakout session. And since you guys felt it was a little short on time, I'll give you guys an additional 3 minutes, and we'll open the breakout session rooms again. So please rejoin your team for the next discussion on response. And if anyone needs any assistance with that, let me know. Thank you. Welcome back, everyone. I hope your sessions went well. But I will pass it off to Pascal to just give us a little overview on his session.
Absolutely, thank you. In our session, when it comes to response, one of the points I stressed is one can be as prepared as one can be, but you can never be fully prepared for calamities and how do you call that, the surprises of life. But that doesn't take away from our responsibilities to at least go through the exercise itself. And yeah, I'll leave it at that. Thank you.
Thank you for that, Pascal. Is Gabriel still on the call?
No, unfortunately, he had to go back for his clinics, but
Okay.
will be myself from now on.
Okay, no worries. And then I'll pass it off to David.
Yes, we had a great series of questions and discussion. And basically, from a threat mitigation standpoint, when you're already in country, we emphasized the development of protocols, so safety protocols, and the frequent meetings every morning to discuss any incidents that may have come up overnight, so that there can be briefs for the entire staff. We discussed protocols for travel, and that needs to be done in groups, possibly convoys. We discussed protocols for communications. And so whatever communication device works in that particular country, whether it's cell, satellite, or two-way radio, making sure that you have the right comms frequencies for the day. That's always important as well. And then frequent check-ins. We discussed GPS monitoring if that's possible. We also discussed in the event of attack, having a lockdown strategy, having safe rooms available, being able to get all of your vulnerable population, both indigenous and expat, into a protected area, having security forces there that are able to escalate as necessary. And then finally discussed evacuation routes and exfil routes to get, if the compound is vulnerable and about to fall, that you can leave in a safe manner. Having go bags to provide food, water, and medical supplies in case of injury is also a part of that.
Wonderful. Thank you so much for sharing that insight. Seems like everyone had some wonderful conversations. And then Bernard?
Am I on mute? Okay, yes. So we also continue with our case-based scenario, had wonderful conversations, discussions, and we created this scenario of response under or in an election year. So there's an election year and there's this outbreak where, especially in Ghana and most African countries, elections are like winner takes all. Like we approach it with a lot of seriousness. So the president is actually concerned with the political, economic, and social impact of the outbreak domestically. He's also concerned about the international repercussions for the country. So how do we balance this? And then we came to how do we look at balance local response versus global expectations? Great insights came or like was part of the discussion, how politics meets public health and the need for public health professionals to understand the interests of politicians in order to develop those skill sets that will meet the political agendas or bring the political narrative and public health working hand in hand together to respond to outbreaks. We had examples from different countries in Africa of how presidents became the front of response. However, they were supported by epidemiologists or the public health, giving or churning out a right form of data in real time. We also underscored the importance of public health practitioners or being cognizant or aware of the international or the political realm, what happens in the political realm. Balancing local response ensures that the local realities are factored in responding, whereas government or politicians will use the diplomatic channels to meet their international obligations. But at the end of the day, what is on the ground, the local realities, what the people are looking for, putting food on their families' tables, going out, making lives better for themselves is what politicians or even the local response should be tailored to. And so we had a lot of how Ghana responded and also got feedback from other regions, other countries, and they all revolve around politics, diplomacy, and public health. Thank you.
Thank you so much for that, Bernard. So yeah, it seems like you guys all had wonderful discussions, and it's great to hear and just to see how these conversations are being directed. So in our final discussion today, we'll be discussing resilience. So this is just more focusing on long-term strategies, creating sustainable global health systems, and just continuing those conversations with the respective teams that you're in right now. Yes, so we are in that session right now. I'll give you guys additional minutes to utilize the last bit of our last and final breakout session of the day. So I will open back those breakout rooms and enjoy. Bernard, do you need assistance? Okay.
CUGH admin, someone, can you patch me to room 3, please? I don't know what happened with my. Yeah, thank you.
You're welcome. Hello, everyone that's in the main room. We are currently in our breakout session. This breakout session is on resilience, and the 3 topics are on the breakout rooms section. So if you just click on that, if you're having trouble joining a breakout room, just let me know and I can help you with that. Thank you.
Summer, are we concluding the breakout rooms?
Yes, I gave an extra couple of minutes because there was just additional time that we could give.
Okay, okay. So we'll be resuming in a minute. Is that right?
Yes, we will be resuming in 1 minute. All righty, welcome back, everyone. I know everyone's just getting back into the main room. So we'll continue with the same as we've done the past general sessions. So I'm going to start off with Pascal to just give us a general overview on his session.
Absolutely. Thank you. When it comes to the last aspect in terms of the meeting, the resilience, one of the points that was stressed is the need for partnership. That partnership itself would create the resilience that one needs. And that partnership should be first, I believe, at the local level, then the national level, if possible, and international level. That is because when it comes to problems in the low middle income country context, there is such a thing as South-South collaboration. So in terms of the solutions for Haiti, the solution more than likely, it could, but more than likely will not come for the high income countries. It will come from our partners in the Global South. Because they encounter similar realities than ours. I give an example of even when the UN mission in Haiti, MINUSTA, was in Haiti, how it was a psychiatrist from Benin who came and was able to work with solutions with us when it comes to the needs of our incarcerated HIV population. So in a nutshell, that's what I'd like to bring forth here. Thank you.
Thank you so much for that insight. And then I'll pass it off to David.
Yes, we had a great discussion. We looked at resilience from a couple of different standpoints. One, and to echo what Pascal said, and I just love that statement, is resilience is built upon partnerships and truly seeing the relationship between the NGO or whatever the implementing partner is and the community as a true equal partnership, not not any disparity at all. And that includes local leaders. It includes people who are just part of the community. So you may have, and I can think of someone in particular, you may have just a mom who came in to have her baby delivered at our place, who then became a real spokesperson for maternal and child health And so, you know, she just on her own has really impacted her own community. So that partnership also translates into sustainability, because those are the people who will run the operation. And so as we build and educate and partner, then we leave. And so the bases are run by Indigenous people, and that partnership is the key to having that happen. There are no Americans at any of our bases, and so that to us is a sign of a sustainability that we wish to recreate other places.
Thank you so much for that. And then Bernard?
Yes, thank you, Summer, once again. We understood, or we highlighted the fact that resilience is work in progress. So that there's no starting point that a country or a region will get to the point that we are resilient to outbreaks, or this is work in progress. Now, with that said, there's this constant need for reviewing and building on lessons learned. We also talk about something that has been echoed by Pascal and David about deepening partnership, whether it's the local or at the international level. And we've seen the importance of how partnership help countries navigate the complexities of responding to outbreak responses. Now, specifically in the African region, building resilience, we also were at the butt, or at the unfortunate end of nationalism when it comes to medical countermeasures. And so building resilience to future outbreak calls for dialogue, calls for doubling down this discussion on building local capacity or regional capacity when it comes to vaccine development, and also research and innovation in domestic diagnostic innovations for diagnostic platforms, and all the things that can help boost our readiness for potential future outbreaks. Yes, we didn't leave workforce development behind. Resilience and sustainability will require continuous investment in workforce development, and also capacity building, as well as health infrastructure.
Wonderful. Thank you so much for all of that insight. I know I was not able to join the breakout sessions, so I'm sure the conversations were much more extensive. And I do have one question that I'd like to, take to the panel is, given these discussions on preparedness, response, and resilience, what is one thing implementation-wise on a systematic, like global health level that if you had a magic wand, what would yours be? I'm just curious to see, what do you feel is something that could be implemented? It could be something as small as, just, enhancing more like that in community driven work on the ground in the field, or, something, bigger. So I know I didn't really prepare you guys for this question, but I'm really curious to see your guys' response on that. Just some final thoughts. We'll start off with Pascal.
Absolutely. And I think David and Bernard hit the nail on the head. David, in mentioning that the indigenous people were well represented in his workforce, where he has effectively prepared for succession. Because whenever he is no longer there, well, people still have to operate, and they have to be equipped with the knowledge and resources to do so. And Bernard hit it on the head too, because during the COVID-19 pandemic, we dealt with vaccine apartheid, right? So as a result of that, okay, we are aware of that issue as such, because we are forewarned with that information, or forearm ourselves with the resources. And I was extremely happy to see the work of the United Nations through the UNIDO, United Nations Industrial Development Organization, and they're definitely doing quite a bit of work when it comes to vaccine manufacturing and medicine production in low middle income countries. So yes, succession is definitely, or the preparation for it is something very important in the low middle income, global health, global South context. Thank you.
Thank you, Pascal. David?
Yes, I think, and I'm not sure this is addressing your question, but the thing that I would love to have a magic wand about is scalability. There are so many challenges in low and middle income countries, especially low income countries, as far as scaling. A lot of them are logistics. A lot of them are, just having enough people to make it work. And that scalability would transform some of these communities. You look at, countries with populations of 10, 15, 20 million. That's not just a whole lot of people. I mean, and those people could be transformed. Obviously, when you're a hammer, everything's a nail. But for me, maternal and child health is key. And those populations could be utterly transformed without just a whole lot. I mean, that wouldn't take much as far as resources or people or anything. So that scalability is where I would love to see that magic wand work.
Awesome. Thank you so much, David. And Bernard?
Yeah, so for my magic one, I'm a strong proponent of localized response backed by science and data. Of course, there's this discussion of local response, but is it scientific? So local response backed by data, that's right data. But how can we localize response if we have limited capacity in domestic manufacturing or limited domestic manufacturing capacity when it comes to diagnosis or medical countermeasures? And so for me, my magic one would be easing the barriers to manufacturing, diagnosis, and medical countermeasures. And that will come into play when the WTO, which of course is a custodian of the trade-related intellectual property rights, the TRIPS agreements, facilitate or ease some of the barriers that hinder, especially low and middle income countries in Africa, to enhance their capacity to get that technical blueprint or that intellectual property right to be able to manufacture things related to diagnostics, therapeutics, and medical countermeasures. So for my magic one is really directed to WTO and the TRIPS-related intellectual property rights to facilitate local response capabilities.
Wonderful. Thank you all so much. Thank you to all of our speakers that were able to host their sessions. Thank you to all of our moderators, Carrie, Anna, Tasha, Oriaku, and Samuel. And thank you, Pascal and Bernard and David, for everything that you guys are able to contribute to today's discussion. That does conclude our session today. I did want to let you guys know that the CUGH 2025 will be held in Atlanta this year. And then if you go to the CUGH2025.org website, you'll be able to access any details and registration. Then, of course, whatever left is of Global Health Week, please join those additional sessions. And if you guys have any questions, please feel free to reach out to any of us. I will put some emails here, but we will send, I think Sarah would help us coordinate the contact list that registered for this to send any additional information that we'd like to share. But thank you to everyone, and I hope everyone has a great rest of their day.